We are more than halfway into the first month of the new year, and many state and federal law enforcement agencies are finishing tallying up numbers they saw for 2024. MTN's Ellie Kaiser met with some of those agencies to see how drug trafficking and use in 2024 compares to previous years.
The Montana Division of Criminal Investigation says that for the first 3 quarters of 2024, over 250,000 drug dosage units were seized by the Rocky Mountain high-intensity drug trafficking area in Montana. That is down from the same period in 2023.
It really doesn't feel that way on the street. 1,000 pills was a big deal to seize, to where we're seeing 10,000 pills and higher than that.
Stephen Crawford oversees the Narcotics Bureau for the Montana Division of Criminal Investigation through the Department of Justice. He has agents within the Rocky Mountain High-Intensity Drug Trafficking Area, or HIDTA. He says the top threats for his bureau are methamphetamine and fentanyl, and they are seeing a rise in cocaine.
Virtually 100% of the methamphetamine and fentanyl that we get comes from Mexico. And when I get the question of how much of that is cartel related, all of it.
Montana has 5 drug task forces and 1 criminal interdiction team through Montana Highway Patrol.
We know that these traffickers are getting smarter. They're using more of the secondary roads. Even some of our gravel roads in Montana being utilized now.
The Drug Enforcement Administration, which is separate from HIDTA, provided their numbers specifically for drugs seized in Montana for 2023 and 2024. They saw 34,000 fewer fentanyl pills, 4 kilograms less of heroin, and 22 kilograms less of methamphetamine. If you or someone you love is in crisis, Chief Crawford recommends calling 988 for help. In Helena, I'm Ellie Kaiser, MTN News.
A 2020 to 2023 report from the Montana Department of Public Health and Human Services says more than 100 people die every year from drug overdoses in Montana. Aside from the investigative work the Department of Justice does, they are also working to decrease those numbers in another way. The Department of Justice provided about 500 Narcan kits to Montana public schools and organizations to help people going through an opioid overdose. Dr. Kyle Moore, the Director of Addiction Medicine and Family Physician at St. Peter's Health in Helena, looks at ways drugs impact a person's physical and mental health. He compares Narcan to a fire extinguisher.
I think everyone should have Narcan in their house because you never know who you're going to interact with that may or may not have a drug problem. For a practical perspective, no, there's no negative effects of using Narcan. If someone is not having an opioid overdose, you're not going to do any harm by giving them Narcan.
Dr. Moore says Narcan is available over the counter at local pharmacies. It is also available for free at a vending machine on the first floor of the Law and Justice Center.